Thank you for taking the time out to answer a couple of questions. I really appreciate it. I know you're busy. And so I just wanted to go over a few things in regards to COVID and pediatric care and those mommies who have some concerns in regards to their babies coming to the doctor. And so if you can answer a few questions for me, I would greatly appreciate it. And we'll just go ahead and get started. So my name is Denisha Prim. I'm the Community Relations Manager at the Lyons location. I'm going to introduce to you our Dr. Iliana Solano. And so Dr. Solano, can you give us a little bit about yourself, please?
My name is Dr. Iliana Solano. I'm a pediatrician at Legacy 5th Ward. I've been with Legacy for over 3 years now and taking care of babies and adolescents up to the age of 18.
What can parents expect during those early well baby visits?
Your baby's first official checkup and first immunizations will take place at the hospital. Then, after their discharge, they should be followed by another visit during the first week of life, and that's usually within 3 to 5 days after being discharged from the hospital. During the visit, your child's pediatrician will check the baby's weight, the length, the head circumference, and we will plot all these measurements on the growth chart. There will be also a physical exam, and that's the right time for you to ask questions to your pediatrician and address any concerns regarding common issues like, eating, sleeping, bowel movements, overall development. We also go over the hospital screening tests, and if there's a need to repeat them or refer the baby to a specialist, we'll do it on that visit too.
Should you take your newborn to well baby visits during the COVID-19 outbreak?
Yes, it is important to bring the babies. And since those early well visits during the first weeks and months of life are so important, it is a good idea to keep these visits. If you push back one visit, you could end up delaying their primary vaccine schedule, and those vaccines are very important in keeping the babies healthy. Also, if you have concerns about being at the doctor's office during this pandemic, please reach out to us and we'll give you advice on the protocols that we're following for keeping the patients and the staff healthy. And also, if there's any need to reschedule or modify the visits, we can work on that too.
How can parents prepare for their newborn's well baby visits?
For that visit, the doctor will examine the baby's entire body, so it's a good idea to dress your baby with simple clothing or just a comfortable blanket. Always important to bring, change of clothes, extra diapers, wipes, a pacifier, feeding supplies, or other necessities. And also be prepared to fill out paperwork. So remember, to pack your insurance card, bring the documents that were given at the hospital before discharge, and that includes the information of the baby's discharge weight or any complications during pregnancy or birth. It is always important to refresh yourself on family medical history to help any questions about your newborn that a pediatrician might ask, and make sure both your hands and that of your baby are clean. Don't use hand sanitizer on an infant. Since it's not safe, but you just, the common hand washing and cleaning the baby's hand with a little bit of water and soap. It is important to keep our social distancing, sitting at least 6 feet away from others in the waiting room. And when you arrive home, it's always, good to, aside from washing your hands, if you can take a shower, bathe your baby, and change both of your clothes immediately.
What should parents know about caring for a newborn during the pandemic?
Well, at least for the first few months, new parents during COVID-19 will be acting a lot like new parents before COVID. So as pediatricians, we usually recommend relative self-isolation and social distancing under normal circumstances. And this is because the newborn's immune system is still developing. So these babies can catch contagious illnesses more easily than older children and adults. And this is not only COVID, this is also for, RSV, common colds, and flu that it's now starting to. Before discharge from the hospital, you have to make sure that all needed procedures are completed, including newborn blood work, hearing, cardiac screening, and medications to prevent complications like, usual medications that are given to the babies, eye ointments, vitamin K, sometimes vitamin D, or iron too. The baby's body is changing rapidly during the first few days after birth. Health conditions like, heart defects, metabolic issues, growth failure, jaundice levels are just a few issues that can be detected after hospital discharge. So again, follow-up appointment with a pediatrician are crucial during these early days to discover and manage the problems that I mentioned before, or follow up on things that were done at the hospital, and we just need to make sure the baby's doing fine, or if not, then have appropriate referrals or evaluations.
Gotcha. So follow-up is very, very important.
It is crucial. Yeah.
Gotcha.
It is crucial. So basically, I tell the parents, think about COVID like you think about the flu, like you think about RSV as another viral infection out there that you need to protect your baby from, but that doesn't limit, or it should not limit, the number of visits or follow-ups with your pediatrician.
What is Legacy doing to protect my newborn during those early newborn well baby visits?
It is understandable that parents want to keep their kids safe. In Legacy, our providers and staff does too. So that is why we're repeatedly cleaning and disinfecting our clinics throughout the whole day. We're screening patients for symptoms of illnesses in advance of in-person visits, and those are done usually by a phone call. We're also scheduling some appointments via telemedicine or telehealth, and this is to minimize the number of people in the clinic at a certain time. If you have any other questions regarding what protocols we're following, or if you want more information on what we're doing at every specific clinic, you can contact Legacy Community Health, call us, ask the questions, and schedule your appointment as well. And another thing is that, we have what we call screeners at the doors. When you get to the clinic, you can not just walk in like you did before COVID.
Exactly.
Someone's going to ask you questions. And if there's a red flag on those answers, then they'll contact us to make sure that that patient is moved into the appropriate room or moved. There's certain protocols that we're following. So you're going to notice a lot of screening over the phone when you get to the clinic, when the nurses see you, and that minimizes the risk of exposure to COVID infected patients.
Absolutely. And there's also social distancing in the clinic as well.
Correct.
Okay, well, is there anything that you would like to add? Anything that you feel is important that the community needs to be aware of?
Yes, one thing that I always bring up on every time I have an opportunity to give a message to the community is about vaccination.
Right.
With COVID, our vaccination rates have decreased, and we have seen a lot of kids that are not getting their vaccines for the same reason of, fear of bringing them to the office. So just to remember that aside from COVID, there's also other bacterial and viral infections that are very dangerous, and they're preventable. So don't forget to bring your baby for the vaccines. Don't delay the vaccines. Bring them on time. If we start delaying vaccines, we're putting at risk our kids for other dangerous diseases aside from COVID. So that's something that I keep saying. Bring your kids, don't delay vaccines, and try to bring them on time.
Right. And how important is the flu shot during the season right now too under COVID?
We're starting to give the flu shot to our patients. And right now with COVID, flu symptoms and COVID symptoms can be very similar.
Wow.
So knowing that your kid got the flu shot, at least that decreases the risk of the kid for getting the flu. It is important to get it. That decreases the risk of getting infected with the flu. And of course, we don't want the kid to have flu and COVID at the same time. Get your flu shot, get it on time. It's given after the age of 6 months, so even babies can get it. And bring the entire family to get the flu shot. The parents, the grandparents, and the people that is around your kids.
Well, thank you so much. I sure appreciate your time. And thank you everyone who viewed this video. If you have any questions, if you want to bring your kids in or you yourself, we have all services for adults as well. We go from OBG to pediatrics to elderly care as well. You can come into the clinic or you can call and make an appointment. Our number is area code 832-548-5000. So give us a call and make an appointment. And again, thank you for your time. I really appreciate it, Dr. Solano. I appreciate you, okay?
Thank you.
All right, you take care.
Thank you.